in my mind, the great gap in India is the community and the knowledge which has a full understanding of the problem, which is able to engage with the political system and have a fully articulated theory of change and have the confidence and the ability to actually roll out some of these things. So in my experience, I've often found a finance minister say, it sounds roughly okay, but do you believe we'll get it done? Do we have the implementation capacity to get it done? So I feel that it is fair that if you are a politician, if you are a minister, you don't want egg on your face. So it's very important for the intellectual side to develop concepts, ideas, the theory of change, translating to concrete operational work programs and develop a community, because nothing can be done by one person. So we should completely get out of this concept that there will be one critical reform champion who will somehow achieve transformative change. To do anything significant requires long years, and it requires large communities. It requires many people of very high capability. Then I feel that we would be at a point where there will be a good conversation with the politician that X is broken, you care that X is broken, you know that X is broken. Here's a fully articulated story, a theory of change. We figured it out, we know it nuts and bolts. It's not just high ideas, we know how to translate it into the machinery of laws and process diagrams, and there is a whole army. There are many people with the requisite skills, and we're able to pull it off. So I feel that's the missing link, that I feel there is angst, there is an incredible level of unhappiness. So you will see most successful politicians say that the bureaucracy doesn't do my bidding, the bureaucracy doesn't get things done. So I think there's such a large dissatisfaction with the machinery of the government, and I feel that the missing link is this intellectual understanding of what is wrong, how would we fix it, what is our foundations of evidence and experience that leads us to believe that this is the right answer, and then concrete documents of laws, organization diagrams, process manuals, and above all, people. We need to build a community that can own this and that can build this.
See, when we are talking of float, what is a float? Float is when money comes out of the government fund and it has not been spent. So it's lying with a private person or lying with a private party. When you think of spending the money through the government department, the concept of float does not arise, because general financial rules, which is basically the Bible or the Gita for public expenditure, it prohibits making any advance payment. Rule 172, I think, of GFR says that no advance payment should be paid by a government. That means payment should be made only after the work has been completed. The float issue does not arise if it is done through a government department. So the general financial rules are very clear that no advance payment can be given to a government department. Payment can be made only when you have incurred the expenditure, so issue of float does not arise in the previous time. But then what was happening during this kind of a system, that monies were being released to the department much later, toward the end of March, so expenditure was not taking place. So the government shifted to getting expenditure done or these schemes delivered through NGOs or through private societies. And there they started giving them advance, so this issue of float arises. And there were also constitutional issues also at that point of time. I remember we had pointed that out, that money cannot go to a particular department outside the consolidated fund. And also there were issues that when you were giving money to these societies, what kind of documentation they were keeping so that the expenditure could be audited. But with the introduction of PFMS, things have been sorted out to quite some extent. There are still issues which have to be taken care of, but things have still been sorted out. PFMS has been given a very high importance in the GFR also. The general financial rules provide that the PFMS should be implemented by each department of the government, and they must ensure that whatever agencies are there under that department, each agency must get registered under the PFMS. All payments should be made through the PFMS, and ultimately whatever kind of bank balance is available with that particular agency should be known to the government department, and they should not have more than their 3 months of requirement as their bank balance. This is what the PFMS scheme provides for. So if payment of money to these societies is being controlled in this manner that their bank balance should not be more than 3 times 3 months expenditure, the issue of float has been sorted out to quite some extent. It cannot be made zero, not really required. It certainly cannot be made zero. It can be made zero if you are incurring it through the government department, but then we run into different kind of a problem. So that is one issue which comes up to my mind, that PFMS, then linked to PFMS is also the integrated financial management system of the state government, which is an integrated kind of system where all financial transactions of the state government have been put together in this. The issue comes up that today PFMS and IFMS are not talking to each other, and that again has been one of the issues which I consider very important, that when you develop systems across a country like India, the data structure must have been same between PFMS and IFMS. I don't know, I have not looked into the data structure, because PFMS has come up after many years of work. The Government of India started with Accounts 2000, and then they came up with something like Compact, then they came up with E-Lekha, and now all these have finally come into PFMS, and I am told that E-Lekha will very soon disappear and everything will be done through PFMS also. But as I said, it is not linked electronically to IFMS. And another issue comes up, that even the state government, the IFMS is not linked to the Accountant General's account keeping, you know. So I think once these issues are settled, then things certainly will become far better than what they are today. See, GFI provided just-in-time funding because payment was being made only after the expenditure has been incurred. But once you do that, then not many delays come up in making payment to the final party. But now that the payment is being made by these NGOs and the societies, then the issue is that there will be some delay always, because some of one of the ills of the system is submission of the utilization certificate, because many NGOs and the societies do not submit the utilization certificate. And if you look into the audit report of the CAG of India, you will find nearly in case of each state, n number of utilization certificates are pending. Number one. Number two, that sometimes even these utilization certificates are not correctly worked out, and they have been given even without completion of the work, because some of the state governments are also very keen that they must get the money coming from central government even if the expenditure has not taken place. I mean, I have seen in 1 or 2 cases that utilization certificate has been given where the money has not really been utilized, because this has come out in our audit reports in quite a few times. So just-in-time funding is possible once your systems speak to each other, once there is a system available across the country which speaks to each other, just-in-time funding will be possible. I think once IFMS and PFMS, they get integrated, then it should be possible.
Increasing state capacity is a huge challenge and priority for the government. It requires a holistic plan that includes better hiring based on competence and responsibility mapping for every position, providing lifelong learning, and creating space for data-driven decision making. One other important piece is increasing accountability through better monitoring. If done well, it can not only help increase state capacity and lead to better delivery of services for the people, but also create greater equity within the government as the underperformers are held accountable. A few years ago, Professor Reenma Hana of the Harvard Kennedy School and I teamed with the National Health Mission in Karnataka to design, pilot, and evaluate an innovative program to improve attendance of doctors and other healthcare providers in rural primary health centers in 5 districts of the state. The program used digital capture of fingerprints and their transmission in real time to the state headquarters as a way to reduce absenteeism. Based on the biometric attendance data, the government planned to issue both positive and negative incentives, that is penalties, like deduction of earned leave for employees with unauthorized absence, as a way to hold the underperformers accountable for their absence. So what was the result? The monitoring system increased attendance among nurses, lab technicians, and pharmacists, almost a 7 percentage point increase from a base of about 40%. But it had no effect, no effect at all on doctor attendance, which stayed at a baseline level of 36%, extremely low. And even this effect went away at a follow-up which took place 2 years after the intervention. So in essence, all the benefits of this program disappeared. But what is incredibly promising was that even this limited improvement in attendance of nurses led to improvements in antenatal care and infant health during those 2 years. So, what has been the insight from this and many other similar studies that we have been involved in over the last few years? First and foremost, it is not easy to create an effective accountability system. A good accountability system requires significant investment of time and effort by senior officials to design it to make sure everything is well thought of and adheres to rules, especially since it intersects with personnel rules and policies, and it also may require additional funding. For instance, in this case, this required funding for the machines, the monthly SIM cards, creating a system for repair and replacement, a data center in Bangalore to collect the data, and understanding how to issue show cause notices that show adherence to the required personnel principle of application of mind if they are machine generated. Second, it requires even more time and effort and capital to implement it well, and the technology alone is not the solution. But the devil, in fact, lies in the detail. For instance, in this particular case, it was not just enough to create a new program and issue orders to others to implement it. One has to make the time to keep listening, to receiving feedback from the field, constantly improve and changing the program to respond to the roadblocks that come, and then also to overcome the political and other opposition that comes with every accountability program. In this case, that included, for instance, changing the incentive system and using the political capital with the finance ministry to make sure funds for incentives were sanctioned in the budget and dispersed on time. Otherwise, the staff would just lose faith in the promise of the National Health Mission. The third and the final lesson is that if you do not get the design and implementation right, an accountability system can actually have unintended negative consequences. For instance, again in this case, once it became clear to the many of the health workers that the system was very difficult to implement, and there were transfers of senior officials who had put their political capital behind it, not only did the system fall into disuse, but in fact attendance went below what it was before the program due to the perverse demonstration effect of absenteeism not having any real consequences on the underperformers. In sum, governments can leverage growth in digitization to improve human resource management and accountability, but technological innovation should be combined with changes in broader rules governing frontline workers and government employees, and long-term financial and political commitment that empowers officials to act on any data that comes from a monitoring or accountability system. Absent that, this will be just a waste of time and resources. But most importantly, as I began, an accountability system can only be one part of a holistic strategy to improve state capacity, with lots of other important points like improved hiring, mapping of the competencies, as well as various other training and lifelong training mechanisms.
Another aspect of state capacity is process. We have to make sure that processes, both internal to the government as well as facing the citizen, are streamlined and almost invisible to everybody. For example, citizen-facing processes should be designed for anytime, anywhere access. An example of that is what we did in the Aadhaar enrollment, where we made sure that anybody could come anywhere in the country and enroll at any time when he or she had 15 minutes to spare. This ability to let the person choose where and when they get access to a service is very important. And hence, We have to make sure that we have anytime, anywhere service, and this is a very important part of what we do.